CNA Mock Exam, per the official CNA NNAAP blueprint. This 70-question practice test simulates the real CNA written exam, using realistic bedside care scenarios you will face as a nursing assistant. Read each question carefully. Think about what the CNA should do first, best, or next, and try to answer before the timer ends.
A nursing assistant is caring for a resident with heart failure.
Which observation should be reported to the nurse immediately? Option A, decreased appetite at breakfast. Option B, difficulty putting on shoes due to swollen feet. Option C, sudden onset of severe shortness of breath. Option D, complaints of fatigue after walking to the bathroom. Correct answer, C. Sudden severe dyspnea in a heart failure patient suggests acute pulmonary edema, a life-threatening emergency requiring immediate intervention. Options A, B, and D are common with heart failure, but not immediately life-threatening. Option B shows expected peripheral edema. A resident with a history of seizures begins to have a tonic-clonic seizure while sitting in a chair. What should the nursing assistant do first? Option A, restrain the resident's arms and legs to prevent injury. Option B, insert a padded tongue blade to prevent tongue biting. Option C, lower the resident safely to the floor. Option D, run to get the nurse before taking any action. Correct answer, C. Safety is the priority. Lower the resident to the floor to prevent fall injury. After ensuring safety, call for help and protect the head. Option A can cause injury. Option B is dangerous and outdated. Option D leaves resident unsafe during the seizure. When providing AM care, a nursing assistant notices white patches on the inside of a resident's mouth that do not wipe off easily. What should the NA do? Option A, scrub the patches vigorously with a toothbrush. Option B, apply petroleum jelly to the affected areas. Option C, report the observation to the nurse. Option D, encourage increased fluid intake to rinse the mouth. Correct answer, C. White patches that don't wipe off easily suggest oral candidiasis, thrush, or another infection requiring medical assessment and treatment. Option A could cause tissue damage. Option B doesn't treat the infection. Option D doesn't address the underlying problem. A nursing assistant is caring for a resident in Buck's traction. The resident complains that the weights are too heavy and asks the NA to remove one weight. What should the NA do? Option A, remove one weight to relieve the resident's discomfort. Option B, explain that the weights cannot be removed and report the complaint to the nurse. Option C, lift the weights slightly off the floor to reduce the pull. Option D, add padding under the boot to decrease pressure. Correct answer, B. Traction weights must never be removed, lifted, or adjusted by nursing assistants. They are prescribed specifically for therapeutic effect. Explain this to the resident and report the complaint to the nurse who can assess pain and provide interventions. Options A, C, and D interfere with prescribed treatment. A resident receiving warfarin, Coumadin, tells the nursing assistant they have been having frequent nosebleeds. What should the NA do? Option A, have the resident tilt their head back and apply pressure. Option B, document the information and monitor for additional bleeding. Option C, pack the nose with tissue and apply ice to the bridge. Option D, report the bleeding to the nurse immediately. Correct answer, D. Frequent bleeding in a resident on anticoagulants suggests possible overmedication and increased bleeding risk. This requires immediate nurse assessment and possible lab work. Options A and C are treatment measures but don't address reporting. Option B, delays necessary intervention. When caring for a resident with left-sided neglect following a stroke, the nursing assistant should, option A, place all items on the right side where the resident can see them. Option B, approach the resident from the left side to increase awareness. Option C, place the call light on the left side to promote use of the affected side. Option D, avoid placing any items on the left side since the resident cannot use that side. Correct answer, B. For left-sided neglect, approach from the neglected left side and encourage the resident to scan to that side to increase awareness and compensation. Initially place important items on unaffected side, but work toward awareness of both sides. Options A and D reinforce the neglect. Option C creates safety risk if resident can't see call light. A nursing assistant observes a resident's respirations and notes they are 10 breaths per minute, shallow, and irregular. What should the NA do first? Option A, document the findings and continue with care. Option B, encourage the resident to take deep breaths. Option C, notify the nurse immediately. Option D, recount the respirations for a full 60 seconds. Correct answer, C. Bradypnea, less than 12 breaths per minute with shallow, irregular pattern, indicates respiratory compromise requiring immediate assessment. While recounting might confirm, the resident needs immediate nursing evaluation. Options A and B delay necessary intervention. A resident with chronic obstructive pulmonary disease, COPD, is receiving oxygen at 2 liters per minute via nasal cannula. The resident requests that the oxygen be increased because of shortness of breath. What should the NA do? Option A, increase the oxygen to 4 liters per minute. Option B, change from nasal cannula to simple face mask. Option C, report the request and shortness of breath to the nurse. Option D, encourage pursed lip breathing and recheck in 15 minutes. Correct answer, C. COPD patients on low-flow oxygen should never have rates changed without physician order, as excessive oxygen can suppress their respiratory drive. Report dyspnea immediately to the nurse. Options A and B are outside NA scope and dangerous for COPD patients. Option D delays necessary assessment. A nursing assistant is assigned to collect a stool specimen for occult blood testing. Which action is correct? Option A, collect the specimen from the toilet water after the resident has a bowel movement. Option B, use a tongue blade to obtain specimen from the formed stool in the bedpan. Option C, wait until the resident has diarrhea to collect a liquid specimen. Option D, collect the specimen after the resident uses hemorrhoid cream. Correct answer B. Stool specimens for occult blood should be collected from formed stool using a clean tongue blade or collection device, avoiding toilet water contamination. Option A contaminates specimen with toilet water. Option C is unnecessary. Option D could cause false results. When providing care for a resident with a colostomy, the nursing assistant notes the stoma appears dark purple-black. What should the NA do? Option A, document the observation and continue with ostomy care. Option B, apply warm compresses to increase circulation to the stoma. Option C, clean the stoma thoroughly with alcohol to remove discoloration. Option D, report the observation to the nurse immediately. Correct answer, D. A dark purple or black stoma indicates tissue necrosis, lack of blood flow, a serious complication requiring immediate medical intervention. Normal stomas are pink, red. Option A delays critical intervention. Options B and C are inappropriate and could worsen the condition. A resident with glaucoma tells the nursing assistant they are having severe eye pain and seeing halos around lights. What should the NA do? Option A. Dim the lights in the room and encourage rest. Option B. Report the symptoms to the nurse immediately. Option C. Apply cool compresses to the affected eye. Option D. Document the complaint and recheck in 1 hour. Correct answer B. Severe eye pain and halos suggest acute angle closure glaucoma, an emergency that can cause permanent vision loss without immediate treatment. This requires urgent medical intervention. Options A, C, and D delay critical care that could prevent blindness. A nursing assistant is preparing to shave a male resident who is receiving anticoagulant therapy. The NA should: Option A, use a straight razor for the closest shave. Option B, use an electric razor to minimize bleeding risk. Option C, apply maximum pressure to prevent mix. Option D, shave against the direction of hair growth. Correct answer B. Residents on anticoagulants are at high bleeding risk. Electric razors minimize the risk of cuts and bleeding. Blade razors should be avoided. Options A and D increase bleeding risk. Option C increases skin irritation and potential bleeding. When measuring urinary output for a resident with an indwelling catheter, the nursing assistant notes only 120 milliliters of dark amber urine has drained over an 8-hour shift. What should the NA do? Option A, encourage increased oral fluid intake. Option B, irrigate the catheter to ensure patency. Option C, report the decreased output to the nurse. Option D, raise the drainage bag to increase flow. Correct answer C. Urinary output less than 30 milliliters per hour, 240 milliliters in 8 hours indicates oliguria, possible dehydration, renal problems, or catheter obstruction requiring immediate assessment. Option A may be ordered later but needs reporting first. Option B is outside NA scope. Option D would cause backflow and infection. A resident becomes verbally aggressive and threatens to hit the nursing assistant during morning care. What is the most appropriate response? Option A, continue providing care quickly to complete the task. Option B, tell the resident they will be restrained if they hit anyone. Option C, step back, maintain calm demeanor, and offer to return later. Option D, call security to remove the resident from the room. Correct answer C. Safety is priority. Create distance, stay calm, and de-escalate by offering space and time. Report the incident to the nurse. Option A puts NA at risk. Option B is threatening and escalates. Option D is premature without attempting de-escalation. A nursing assistant is caring for a resident with hepatitis B. Which item requires special handling as biohazardous waste? Option A, the resident's dinner tray. Option B, linen soiled with urine only. Option C, tissues containing dried blood. Option D, the resident's personal clothing. Correct answer C. Items contaminated with blood are biohazardous waste and must be disposed of in red bags per bloodborne pathogen protocols. Hepatitis B is transmitted through blood. Options A, B, and D don't typically require biohazard disposal unless visibly contaminated with blood. When providing passive range of motion to a resident's knee, the nursing assistant should: Option A, flex and extend the knee while keeping the hip straight. Option B, flex the hip and knee simultaneously, then extend. Option C, rotate the knee in circular motions. Option D, hyperextend the knee beyond its normal range. Correct answer B. Knee ROM is performed by flexing both hip and knee together, then extending. This is the natural movement pattern. Option A doesn't allow full knee flexion. Option C describes rotation, which isn't a primary knee motion. Option D could cause injury. A resident with a history of transient ischemic attacks, TIAs, suddenly has difficulty speaking and right arm weakness. What should the nursing assistant do first? Option A, document the time of symptom onset and notify the nurse immediately. Option B, assist the resident to lie down and elevate the affected arm. Option C, offer the resident water to see if swallowing is affected. Option D, perform range of motion on the affected arm. Correct answer A. These symptoms suggest possible stroke. Time of onset is critical for treatment decisions. Thrombolytic therapy has a time window. Note time and notify nurse immediately. Option B delays notification. Option C risks aspiration if swallowing affected. Option D is inappropriate during acute event. A nursing assistant is caring for a resident who follows a Hindu diet. The resident's meal tray contains beef stew. What should the NA do? Option A, serve the meal since dietary prepared it. Option B, remove the beef and serve the remaining items. Option C, contact dietary for an appropriate meal. Option D, offer vegetarian items from other meal trays. Correct answer C. Many Hindus do not eat beef. Cows are sacred. The meal is inappropriate, and dietary must provide a suitable alternative. Option A disrespects religious dietary restrictions. Option B may not make the meal acceptable. Contamination concerns. Option D is unsanitary and may not meet dietary needs. A resident with terminal cancer has an order for comfort measures only. The resident stops breathing and has no pulse. What should the nursing assistant do? Option A, begin CPR immediately. Option B, call a code and activate emergency response. Option C, stay with the resident and notify the nurse. Option D, cover the resident and begin postmortem care. Correct answer C. Comfort measures only typically indicates DNR, do not resuscitate status. Do not initiate CPR. Stay with the resident, provide dignified care, and notify the nurse who will verify death and notify family/physician. Options A and B violate the care plan. Option D is premature. Nurse must pronounce death first. When assisting a resident with a walker, the nursing assistant should instruct the resident to Option A, move the walker forward, then step forward with both feet together. Option B, move the walker and weaker leg forward together, then the stronger leg. Option C, move the walker forward, step with stronger leg, then weaker leg. Option D, move the walker forward, step with weaker leg, then stronger leg. Correct answer D. Correct walker sequence. Move walker forward, step with weaker leg, into the walker support, then step with stronger leg. This provides maximum support. Option B moves both simultaneously. Option C steps with stronger leg first, less stable. Option A doesn't alternate legs properly. A nursing assistant notes a resident's blood glucose reading is 52 milligrams per deciliter. The resident is awake and alert. What should the NA do first? Option A, give the resident 4 ounces of orange juice. Option B, have the resident eat their regular meal. Option C, report the reading to the nurse immediately. Option D, recheck the blood glucose in 15 minutes. Correct answer, C. Blood glucose below 70 milligrams DL is hypoglycemia, requiring immediate nurse notification. While the resident is alert now, they could rapidly deteriorate. The nurse will assess and order appropriate intervention. Options A and B are outside NA scope without orders. A resident receiving dialysis treatment tells the nursing assistant they feel dizzy and nauseated. What should the NA do? Option A, lower the head of the bed and elevate the feet. Option B, offer crackers and ginger ale for the nausea. Option C, notify the dialysis nurse immediately. Option D, take the resident's blood pressure. Correct answer C. Dizziness and nausea during dialysis suggest hypotension or other complications requiring immediate assessment by the dialysis nurse, who can adjust treatment. Options A and D may be done, but notification is priority. Option B could worsen complications if related to fluid shifts. When providing nail care, the nursing assistant files a resident's fingernails and notices one nail has separated from the nail bed and appears greenish. What should the NA do? Option A, trim the separated portion of the nail. Option B, apply antifungal cream to the affected nail. Option C, soak the finger in warm soapy water. Option D, report the observation to the nurse. Correct answer D. Nail separation with green discoloration suggests infection, often Pseudomonas, requiring medical treatment. Report to nurse for assessment. Options A, B, and C are outside NA scope and could spread infection or delay appropriate treatment. A resident with Parkinson's disease is experiencing pill-rolling tremors that worsen when at rest. When should the nursing assistant schedule activities requiring fine motor skills? Option A, first thing in the morning before medications. Option B, about 1 hour after the resident takes medication. Option C, late afternoon when the resident is most relaxed. Option D, right before bedtime when the resident is calm. Correct answer B. Parkinson's medications peak effectiveness about 1 hour after administration, when tremors and rigidity are most controlled. This is optimal time for fine motor activities. Option A is when symptoms are worst, before medication. Options C and D are when medication effects may be wearing off. A nursing assistant is assigned to take an apical pulse on a resident. Where should the stethoscope be placed? Option A, at the left midclavicular line at the 5th intercostal space. Option B, at the right midclavicular line at the 2nd intercostal space. Option C, at the center of the sternum at the 3rd intercostal space. Option D, at the left anterior axillary line at the 7th intercostal space. Correct answer A. The apical pulse is auscultated at the point of maximal impulse, PMI, located at the left midclavicular line at the 5th intercostal space. This is where the apex of the heart is closest to the chest wall. Options B, C, and D are incorrect anatomical locations. A resident with rheumatoid arthritis reports severe morning stiffness that lasts several hours. What can the nursing assistant do to help? Option A, encourage complete bed rest until the stiffness resolves. Option B, apply cold packs to affected joints upon awakening. Option C, assist with a warm shower or bath in the morning. Option D, perform vigorous passive range of motion exercises. Correct answer C. Warmth, warm shower, bath, or warm compresses helps reduce morning stiffness in rheumatoid arthritis. Gentle activity also helps. Option A worsens stiffness. Option B would increase stiffness. Cold is for acute inflammation. Option D could cause pain and damage inflamed joints. A nursing assistant observes that a resident's pulse oximeter reading fluctuates between 78% and 85%. What should the NA do first? Option A, check that the sensor is properly positioned and the resident's finger is warm. Option B, immediately apply oxygen at 2 liters per minute. Option C, document the readings and continue monitoring. Option D, notify the nurse of the low oxygen saturation. Correct answer, A. First, verify accuracy. Check sensor placement, ensure finger is warm, and look for nail polish or poor perfusion causing false readings. If reading remains low after verification, then notify nurse immediately. Options B and D are appropriate after confirming accuracy. Option C alone is insufficient if reading is accurate. A resident has an order for sequential compression devices, SCDs, to prevent deep vein thrombosis. The nursing assistant should, Option A, apply the devices tightly to ensure adequate compression. Option B, remove the devices during meals and activities. Option C, remove the devices for skin assessment and bathing per facility protocol. Option D, leave the devices on continuously without removal. Correct answer, C. SCDs should be removed periodically per protocol, usually every 8 to 12 hours, for skin assessment and bathing, then reapplied. Option A risks impaired circulation. Option B removes them too frequently, defeats purpose. Option D never allows skin assessment, which could miss pressure injuries. When caring for a resident with multiple sclerosis who is experiencing an exacerbation, the nursing assistant should, Option A, encourage hot baths to relax muscles and reduce spasms. Option B, maintain a cool room temperature to prevent symptom worsening. Option C, promote vigorous exercise to maintain muscle strength. Option D, restrict fluid intake to reduce urinary frequency. Correct answer, B. Heat worsens MS symptoms. Cool environment helps. Many MS patients are heat sensitive. Option A would worsen symptoms. Option C would cause fatigue and worsen exacerbation. Gentle exercise during remission is appropriate. Option D could cause dehydration and urinary complications. A resident who is 2 days post-operative tells the nursing assistant, "I think my incision just opened up." What should the NA do first? Option A, remove the dressing to assess the incision. Option B, apply direct pressure to the incision site. Option C, have the resident lie down and call for the nurse immediately. Option D, reassure the resident and encourage deep breathing. Correct answer, C. Suspected wound dehiscence requires immediate intervention. Keep resident in bed. Call nurse immediately. The nurse will assess the wound. Option A is outside NA scope. Option B is inappropriate without seeing the wound. Option D delays necessary urgent assessment. A nursing assistant is preparing to transfer a resident who weighs 280 pounds from bed to wheelchair. The resident can bear partial weight. What should the NA do? Option A, attempt the transfer alone using proper body mechanics. Option B, use a mechanical lift for the transfer. Option C, ask another nursing assistant to help with the transfer. Option D, have the resident transfer independently with verbal cueing. Correct answer, B. Mechanical lifts should be used for residents over 200 pounds or who cannot bear full weight, even with assistance, to prevent staff and resident injury. Options A and C risk injury to staff and resident. Option D risks resident fall. Resident can only bear partial weight. A resident with a nasogastric tube to continuous suction is complaining of a dry, sticky mouth. What can the nursing assistant do? Option A, give the resident ice chips to suck on. Option B, provide frequent oral care and moist swabs. Option C, offer small sips of water every hour. Option D, clamp the NG tube during oral care. Correct answer B. Residents with NG tubes to suction are typically NPO or have restricted intake. Provide frequent oral care and moist mouth swabs for comfort. Options A and C may violate NPO status or intake restrictions. Option D is outside NA scope and interferes with therapy. When documenting, a nursing assistant should record Option A, opinions about why the resident is behaving a certain way. Option B, objective observations and exact quotes when relevant. Option C, what the resident should have done differently. Option D, other staff members' performance during care. Correct answer B. Documentation should be objective, factual, and specific. Use exact quotes for subjective data. Avoid interpretations, opinions, or judgments. Option A records opinions. Option C is judgmental. Option D is inappropriate unless reporting a safety concern through proper channels. A resident with osteoporosis loses balance and falls, landing on their hip. The resident cannot move the affected leg and it appears shortened and externally rotated. What should the NA do? Option A, help the resident stand up and assist them back to bed. Option B, straighten the affected leg and apply ice. Option C, stay with the resident, keep them still, and call for help immediately. Option D, perform range of motion to assess for injury. Correct answer C. These signs suggest hip fracture. Do not move the resident. Keep them still, provide comfort, call for immediate help. Movement could worsen injury and cause complications. Options A, B, and D could cause severe damage to fracture site and surrounding tissues. A nursing assistant is caring for a resident receiving total parenteral nutrition, TPN, via central line. The NA should, Option A, monitor the infusion rate and adjust as needed. Option B, use the TPN line to draw blood specimens. Option C, report if the dressing becomes wet or loose. Option D, disconnect the TPN to allow the resident to shower. Correct answer C. NAs should report wet or loose central line dressings, infection risk. TPN management is outside NA scope. Option A is beyond NA scope. Option B contaminates the line. Option D is outside NA scope and interrupts critical nutrition therapy. A resident with expressive aphasia following a stroke is trying to communicate. What is the best approach? Option A, speak loudly and slowly so the resident can understand better. Option B, finish the resident's sentences to reduce frustration. Option C, use yes-no questions and give time to respond. Option D, communicate through writing since the resident cannot speak.
Correct answer C. Expressive aphasia affects speech production, not comprehension. Use simple yes-no questions, give time to respond, and be patient. Option A is for hearing impairment. Option B increases frustration. Option D may not work if writing is also affected. When measuring temperature using a temporal artery thermometer, the nursing assistant should: Option A, place the thermometer on the center of the forehead and hold still. Option B, slide the thermometer across the forehead to the hairline. Option C, place the thermometer behind the ear and hold for 10 seconds. Option D, slide the thermometer down the side of the neck. Correct answer
B. Temporal artery thermometers should be swept across the forehead from center to hairline over the temporal artery. This captures the highest temperature reading. Options A, C, and D don't follow proper temporal artery measurement technique. A resident receiving chemotherapy develops a fever of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. What should the nursing assistant do? Option A, apply cool compresses and encourage fluids. Option B, report the fever to the nurse immediately. Option C, give acetaminophen as needed for fever. Option D, document the fever and recheck in 4 hours. Correct answer. B. Fever in chemotherapy patients suggests possible infection which can be life-threatening due to immunosuppression. This is a medical emergency requiring immediate assessment and possible antibiotics. Options A, C, and D delay critical intervention. Option C is outside NA scope. A nursing assistant is caring for a resident in the late stages of Alzheimer's disease who has become increasingly withdrawn and is sleeping most of the day. What should the NA do? Option A, allow the resident to sleep undisturbed as much as possible. Option B, wake the resident frequently to prevent excessive sleeping. Option C, provide care, gentle stimulation, and report changes to the nurse. Option D, request a sleeping medication to normalize the sleep pattern. Correct answer. C. Increased sleeping in late-stage dementia should be accommodated, but changes must be reported. Could indicate infection, depression, or disease progression. Provide gentle care and appropriate stimulation. Option A neglects care needs. Option B may increase agitation. Option D is outside NA scope and may be inappropriate. When providing perineal care for an uncircumcised male resident, the nursing assistant should: Option A, retract the foreskin, clean and leave retracted to air dry. Option B, retract the foreskin gently, clean, dry, and return foreskin to normal position. Option C, avoid retracting the foreskin to prevent injury. Option D, retract the foreskin only if the resident requests it. Correct answer. B. Gently retract foreskin, if possible. Clean, dry, and always return foreskin to normal position. Leaving foreskin retracted causes paraphimosis, emergency. Option A causes paraphimosis. Option C doesn't provide adequate cleaning. Option D doesn't ensure proper hygiene. A resident taking diuretics tells the nursing assistant they feel weak, tired, and are having muscle cramps. What should the NA do? Option A, encourage the resident to eat a banana and drink orange juice. Option B, reduce the resident's fluid intake to decrease urination. Option C, report the symptoms to the nurse. Option D, suggest the resident rest and recheck later. Correct answer. C. Weakness, fatigue, and muscle cramps suggest possible electrolyte imbalance, hypokalemia, from diuretics. Report to nurse, who can order labs and interventions. Option A may be ordered later, but requires reporting first. Option B is dangerous. Option D delays necessary assessment. A nursing assistant observes a resident's roommate going through the resident's personal belongings and taking money from their wallet. What should the NA do? Option A, confront the roommate and demand the money be returned. Option B, move the wallet to a secure location and say nothing. Option C, report the observation to the nurse immediately. Option D, tell the resident's family about the theft. Correct answer. C. Suspected theft must be reported to the nurse/supervisor immediately, for proper investigation and documentation. Do not confront safety risk or compromise investigation. Option A creates safety risk. Option B doesn't address the theft. Option D is inappropriate before facility investigation. A resident with left-sided heart failure should be positioned. Option A, flat supine to reduce cardiac workload. Option B, with the head of bed elevated 30 to 45 degrees. Option C, on the left side to improve heart function. Option D, in Trendelenburg position to improve circulation. Correct answer, B. Elevating the head of bed, Fowler's or semi-Fowler's, reduces pulmonary congestion and eases breathing in heart failure. Option A, worsens pulmonary congestion. Option C, doesn't specifically help heart failure symptoms. Option D, increases pulmonary congestion. When caring for a resident with neutropenia, low white blood cell count, the nursing assistant should: Option A, restrict all visitors to prevent infection exposure. Option B, practice meticulous hand hygiene before and after care. Option C, encourage a diet high in fresh fruits and raw vegetables. Option D, perform aggressive oral care to prevent mouth sores. Correct answer, B. Hand hygiene is the most important infection prevention measure for immunocompromised residents. Option A is too restrictive. Limit sick visitors. Option C is dangerous. Fresh produce may carry bacteria. Cooked foods preferred. Option D should be gentle, not aggressive. A nursing assistant notices a resident has a full-thickness pressure injury on the heel with visible bone. This is classified as Option A, Stage 1 pressure injury. Option B, Stage 2 pressure injury. Option C, Stage 3 pressure injury. Option D, Stage 4 pressure injury. Correct answer, D. Stage 4 pressure injuries have full-thickness tissue loss with exposed bone, tendon, or muscle. Stage 1 is intact skin with non-blanchable redness. Stage 2 is partial thickness with exposed dermis. Stage 3 is full thickness without exposed bone, muscle. A resident who is bedbound has an order to be repositioned every 2 hours. The nursing assistant is busy with other residents and has not turned the resident for 4 hours. What should the NA do? Option A, reposition the resident now and document every 2 hours anyway. Option B, reposition the resident and document the actual time of turning. Option C, skip this turning since it's almost time for the next scheduled turn. Option D, ask another NA to turn the resident and document it. Correct answer, B. Document honestly and accurately. Falsifying documentation is illegal and unethical. Reposition now, document actual time, and report the missed turning to the nurse. Option A is fraudulent documentation. Option C increases pressure injury risk. Option D doesn't correct the documentation issue. A resident receiving peritoneal dialysis complains of severe abdominal pain, and the dialysate return appears cloudy. What should the nursing assistant do? Option A, continue the dialysis as cloudy dialysate is normal. Option B, stop the dialysis and notify the nurse immediately. Option C, increase the flow rate to flush out the cloudiness. Option D, add 1 compresses to the abdomen for comfort. Correct answer, B. Cloudy dialysate with abdominal pain suggests peritonitis, a serious infection requiring immediate intervention. Stop the dialysis and notify the nurse. Normal dialysate is clear. Options A and C continue potentially dangerous situation. Option D delays critical intervention. When using a fire extinguisher during a facility fire, the nursing assistant should remember the acronym PASS, which stands for Option A, pull, aim, squeeze, sweep. Option B, push, activate, spray, stop. Option C, pull, activate, spray, shake. Option D, push, aim, squeeze, stop. Correct answer. A, pass. Pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. This is the correct fire extinguisher operation sequence. Options B, C, and D contain incorrect steps. A resident with chronic kidney disease has an arteriovenous AV fistula in the left forearm. When providing care, the nursing assistant should: Option A, take blood pressure on the left arm to monitor circulation. Option B, apply firm pressure when taking the radial pulse on the left. Option C, avoid any constricting clothing or devices on the left arm. Option D, perform venipuncture on the left arm for blood draws. Correct answer, C. AV fistulas must be protected from any constriction, blood pressure cuffs, IVs, or venipuncture that could damage the access. Option A could damage the fistula. Option B could compress the fistula. Option D could damage the access needed for dialysis. A nursing assistant is caring for a resident with left lower lobe pneumonia. How should the resident be positioned to maximize oxygenation? Option A, on the left side with affected lung down. Option B, on the right side with good lung down. Option C, supine with head of bed flat. Option D, prone position on the abdomen. Correct answer, B. Position with the good lung down to maximize ventilation perfusion matching. Gravity helps perfuse the healthy lung. Option A reduces oxygenation to the good lung. Option C doesn't optimize ventilation. Option D is uncomfortable and impractical for most residents. A resident who is receiving radiation therapy for lung cancer tells the nursing assistant that the skin over the treatment area is red, painful, and peeling. What should the NA do? Option A, apply lotion to moisturize the affected skin. Option B, wash the area with antibacterial soap. Option C, report the skin condition to the nurse. Option D, apply a heating pad to increase circulation. Correct answer, C. Radiation skin reactions, radiation dermatitis, require nurse assessment and specific treatment orders. Special skin care is needed. Options A, B, and D could worsen radiation burns. Many products are contraindicated during radiation therapy. When caring for a resident with a hearing aid, the nursing assistant notes the device is making a whistling sound. This is most likely due to Option A, dead batteries needing replacement. Option B, the hearing aid not being inserted properly. Option C, excessive earwax blocking the ear canal. Option D, the volume being set too low. Correct answer, B. Whistling feedback typically occurs when the hearing aid isn't seated properly in the ear canal, allowing sound to leak out and feed back into the microphone. Option A causes no sound. Option C may muffle sound but doesn't cause whistling. Option D causes quiet sound, not whistling. A nursing assistant is caring for a resident who is Muslim and is fasting for Ramadan. The resident's medication is scheduled for 2 p.m. What should the NA do? Option A, hold the medication until sunset when the resident can eat. Option B, crush the medication and give it without food or water. Option C, report the situation to the nurse to determine how to proceed. Option D, tell the resident they must take the medication with food. Correct answer C. Religious fasting may conflict with medication schedules. Report to the nurse, who can contact the physician about adjusting medication times or discuss with the resident. Option A holds prescribed medication without authorization. Options B and D don't respect religious practices or problem solve appropriately. A resident with amyotrophic lateral sclerosis (ALS) is having increasing difficulty swallowing. Which observation requires immediate reporting? Option A, coughing or choking during meals. Option B, requesting foods be cut into smaller pieces. Option C, taking longer to finish meals. Option D, preferring softer food textures. Correct answer A. Coughing or choking during meals indicates aspiration risk, a serious and potentially life-threatening complication in ALS patients with dysphagia. Requires immediate assessment and possible swallow evaluation. Options B, C, and D are expected adaptations but don't indicate immediate danger. When providing care to a resident in skeletal traction, the nursing assistant should: Option A, remove the weights when repositioning the resident. Option B, ensure the weights hang freely and do not touch the floor. Option C, adjust the amount of weight based on the resident's comfort. Option D, encourage the resident to move the affected extremity frequently.
Correct answer B. Traction weights must always hang freely without touching the floor or bed to maintain prescribed therapeutic pull. Never remove, lift, or adjust weights. Option A disrupts the traction. Option C is outside NA scope. Option D could disrupt fracture alignment. A nursing assistant observes a resident self-administering insulin injection. The resident draws up the insulin but does not clean the injection site with alcohol before injecting. What should the NA do? Option A, say nothing since the resident is independent with injections. Option B, stop the resident and insist on cleaning the site. Option C, document the observation and report to the nurse. Option D, clean the site after the resident finishes the injection.
Correct answer C. While current evidence shows alcohol swabs may not always be necessary for insulin injections, the resident should follow their care plan. Document and report to the nurse, who can assess technique and provide education if needed. Option A ignores potential teaching need. Option B may be confrontational. A resident receiving total parenteral nutrition (TPN) complains of chest pain, shortness of breath, and appears anxious. What should the nursing assistant do first? Option A, slow the TPN infusion rate. Option B, disconnect the TPN and flush the line. Option C, stay with the resident and call for the nurse immediately. Option D, position the resident flat on their left side. Correct answer C. These symptoms suggest possible air embolism or other serious complication. Stay with resident and get immediate help. Do not manipulate the TPN. Outside NA scope. Option A is outside NA scope. Option B could worsen air embolism. Option D is inappropriate positioning. A nursing assistant is delegated to apply a warm, moist compress to a resident's wound. The water temperature should not exceed: Option A, 105 degrees Fahrenheit, 40.5 Celsius. Option B, 115 degrees Fahrenheit, 46 Celsius. Option C, 125 degrees Fahrenheit, 51.5 Celsius. Option D, 135 degrees Fahrenheit, 57 Celsius. Correct answer A. Warm compresses should not exceed 105 degrees Fahrenheit to prevent burns, especially for residents with decreased sensation, fragile skin, or impaired circulation. Always test temperature before application. Options B, C, and D are too hot and risk thermal injury. When caring for a resident with vancomycin-resistant enterococcus, VRE, the nursing assistant should: Option A, wear N95 respirator when entering the room. Option B, use dedicated equipment that stays in the room. Option C, restrict all visitors until the infection clears. Option D, place the resident in a negative pressure room. Correct answer, B. VRE requires contact precautions including dedicated equipment that remains in the room. Option A describes airborne precautions, not needed for VRE. Option C is too restrictive. Option D describes airborne precautions setup. A resident tells the nursing assistant, "I'm going home to see my mother today," but the resident's mother has been deceased for 15 years and the resident lives in a long-term care facility. How should the NA respond? Option A, that's not possible. Your mother died 15 years ago. Option B, what do you miss most about your mother? Option C, you live here now. This is your home. Option D, let me call your mother and tell her you're coming. Correct answer, B. Use validation therapy. Connect with the emotion rather than correcting the reality. This approach provides comfort and acknowledges feelings. Option A causes distress through reality orientation. Option C may increase confusion. Option D is dishonest. A nursing assistant notices a resident's telemetry monitor shows an irregular heart rhythm with a rate of 140 beats per minute. What should the NA do first? Option A, check if the telemetry leads are properly attached. Option B, take the resident's pulse manually and compare to the monitor. Option C, notify the nurse immediately about the rhythm. Option D, document the heart rate and continue monitoring. Correct answer, C. An irregular rhythm at 140 BPM tachycardia requires immediate nurse notification regardless of cause. This could indicate serious arrhythmia requiring intervention. While verifying lead placement is reasonable, the priority is immediate notification given the abnormal rate and rhythm. A resident who is blind asks the nursing assistant for assistance walking to the dining room. How should the NA provide guidance? Option A, hold the resident's arm and guide them from behind. Option B, allow the resident to hold the NA's arm just above the elbow. Option C, walk behind the resident with hands on their shoulders. Option D, hold the resident's hand and walk beside them. Correct answer, B. Sighted guide technique. The blind person holds the guide's arm just above the elbow and walks slightly behind. This allows the blind person to feel the guide's movements and maintain independence. Options A, C, and D don't follow proper sighted guide technique. A nursing assistant is caring for a resident receiving enteral feeding via nasogastric tube. Before starting the feeding, the NA should: Option A, verify tube placement by aspirating stomach contents. Option B, ensure the head of the bed is elevated at least 30 degrees. Option C, notify the nurse that the feeding is ready to start. Option D, flush the tube with cranberry juice to prevent clogging. Correct answer, C. NAs do not manage tube feedings. Notify the nurse who will verify placement, check residual, position the resident appropriately, and initiate feeding. Options A, B, and D are components of tube feeding management but are outside NA scope. When providing hair care for an African American resident with tightly curled hair, the nursing assistant should: Option A, brush vigorously to remove all tangles. Option B, Use a wide-tooth comb and work from ends to roots. Option C. Wash daily to prevent oil buildup. Option D. Avoid using any hair products or oils. Correct answer B. Tightly curled hair requires gentle detangling with a wide-toothed comb, starting at the ends and working toward the roots to prevent breakage. Option A causes hair breakage. Option C overdries hair. Textured hair often needs oils. Option D ignores that oils, moisturizers may be needed for this hair type. A resident with advanced dementia refuses to open their mouth for oral care. What is the best approach? Option A. Force the mouth open to provide necessary care. Option B. Skip oral care for today and try again tomorrow. Option C. Gently stroke the chin and cheeks and offer small amounts of care. Option D. Request an order for sedation before providing oral care. Correct answer, C. Use gentle touch, calmly offer care in small increments, and use distraction or comfort techniques. Never force care. Option A is assault. Option B neglects necessary hygiene. Option D is excessive and inappropriate for routine resistance. A nursing assistant observes that a resident with peripheral vascular disease has a foot ulcer that appears to have black tissue in the center. What should the NA do? Option A, clean the black tissue out of the wound. Option B, apply antibiotic ointment and cover with a bandage. Option C, soak the foot in warm water to soften the tissue. Option D, report the observation to the nurse without manipulating the wound. Correct answer, D. Black tissue suggests eschar, necrotic tissue, requiring assessment by the nurse. Do not manipulate wounds or apply treatments without orders. Options A, B, and C are outside NA scope and could damage tissue or delay appropriate treatment. A resident who is receiving chemotherapy asks the nursing assistant why they must use a separate bathroom from their roommate. The best explanation is Option B. Your body fluids contain chemotherapy that could harm your roommate. Correct answer B. Chemotherapy is excreted in body fluids, urine, stool, vomit, for 48 to 72 hours after treatment and could expose others. Separate toileting facilities protect the roommate. Option A is true, but doesn't explain the separate bathroom need. Options C and D don't address the actual reason. When caring for a resident who has dysphagia and is receiving thickened liquids, the nursing assistant notes the resident is coughing frequently after taking sips of thickened juice. What should the NA do? Option A. Continue offering the thickened liquid since it is ordered. Option B. Thin the liquid slightly to make it easier to swallow. Option C. Stop offering liquids and notify the nurse. Option D. Switch to thin liquids since the resident is having difficulty. Correct answer, C. Coughing during swallowing indicates possible aspiration even with thickened liquids. Stop immediately and report to the nurse who may need to arrange swallow evaluation. Options A and D risk aspiration. Option B is outside NA scope and could worsen aspiration. A resident with a seizure disorder tells the nursing assistant they feel a strange sensation in their stomach and smell something unusual, even though nothing is there. What should the NA do? Option A. Reassure the resident these sensations are not real. Option B. Check the room for unusual odors or gas leaks. Option C. Recognize this may be a seizure aura and notify the nurse. Option D. Suggest the resident has indigestion and offer antacids. Correct answer, C. Unusual sensations, smells, or feelings, auras, often precede seizures. Report to the nurse and prepare for possible seizure. Safety measures. Option A dismisses important warning signs. Option B wastes time. Option D misinterprets serious symptom. A nursing assistant is caring for a resident who has an advance directive stating no artificial nutrition or hydration. The resident is no longer able to swallow. The family requests a feeding tube be placed. What should the NA do? Option A. Support the family's request since they have the right to decide. Option B. Report the conflict between the advance directive and family wishes to the nurse. Option C. Explain to the family that the advance directive must be followed. Option D. Suggest the family speak with the physician about the feeding tube. Correct answer, B. Conflicts between advance directives and family wishes must be reported to the nurse supervisor for appropriate handling by the interdisciplinary team, social services, and ethics committee if needed. This is beyond the NA's scope to resolve. Options A and C take positions inappropriately. Option D doesn't report through proper channels. Nice work. Review any questions you missed. If you were able to work through these 70 scenario-based questions, you are building the exact decision-making skills tested on the real CNA exam. For more CNA practice exams, skills questions, and exam preparation videos, explore the rest of the MedPrep Prime CNA playlist.